over that. And this is for my class called Veterinary Nursing Care. The course number is 2439. This is Russo. With him, I'm gonna do a heartline osculation. So this is how I would do it. He's a really good boy. I don't need anybody else to restrain him. So what I'm gonna listen for first is the lungs. And because he is a big breed dog, he's a Great Pyrenees, we're gonna do the grid and listen to all 9 quadrants. So we'll listen to his chest up here, and then right down here, down here, down here, and then down here, and then again up here, and then the middle, and then up here. Hey, pups, and then right here. All right, and let me listen to him real quick. And you want to start on the left side, and then work yourself to the right side. So here I go. Give me 1 second. Grab yourself. And good boy. Back up. There you go. Alright, it sounds pretty clear. He's breathing really well. Some things that you'll be alert from is if you hear any crackling or any rasp or any sounds like that in the lungs, then there's probably some liquid or something going wrong in his lungs. And also you want to do is look at his gum line, and if it's a good nice pink color, it means that he's getting good oxygen. That's also a good indicator if they're not breathing well. You can also observe them and see if they're not gasping for oxygen or anything like that. Now I'm going to listen to the heart and also listen to the other side of the lungs. And for the heart, you also want to start on the left side, and you want to count how many beats per minute. Good boy. I'm going to switch him to the other side to listen to his heart. Come here, Papa. And right down here. You can go into his chest as well. His heart rate is 108 beats per minute. It sounds like a good lub-dub, lub-dub, lub-dub. Really good beat, strong pulse. I didn't hear any murmurs or arrhythmias. Usually what you'll sound is like a whooshing sound. I didn't hear any of that, so he's a good healthy pet. Alright, so for this next part of the video, I'm going to go over a rabies pole. This is a rabies pole. You usually have them hanging from here so that it doesn't kink. And then also this part of the rabies pole, you would like to sneak it into this hole right here. So this also doesn't kink. So when you're using it to open it, this opens up smoothly, just like that. Now when you're confronting a dog with a rabies pole, it's usually because they're either rabid or they're really aggressive dogs. Hopefully when you're facing this dog, you can face him while he's not facing you and he's facing away. And then what you want to do is go under his head, under and over, just like that, and tighten this up. But not too tight where they can't breathe. Now, now that you have him tied up, you can use this to transport them, and then he's also going to be in a safe distance from you, and he's not going to be able to bite you. This part of the rabies pool is made out of rubber, or has a rubber protector, and it's designed this way so that if an aggressive dog is on here, most of the time they won't be acting like Russo is. They'll probably roll around, and if they do roll around, you want to make sure you twist around them. That way they don't choke. Now Russo, and let me going back to the design of this rabies pool with the rubber is so that if he does decide to bite on the tube, he doesn't bite on the metal and hurt himself, and he's just biting on something softer. And to release him, what you want to do is pull on this lever right here. You pull on the lever. Watch out for this because this usually swings around and could hit you. And release him. And usually you want to put him inside of a kennel. And this is how you probably use a rabies pool. Okay, for this next of the video, I'm going to show how to properly disinfect and clean a kennel. This is one of our biggest kennels that we have here in our clinic. This one has already been used, so it's dirty. First, what you want to do is remove anything that's in here. If there was some left behind poop or urine, you also want to clean that first, and obviously put some gloves on. But it doesn't look that bad, so what I'm going to also do is remove the cage cord that the patient's name was on. And then you want to make sure you soak the whole kennel with Wash Dog or any type of disinfectant that your clinic uses. And spray all the sides and the top part and the bottom with the disinfectant. And also spray the top of the kennel here on the sides and the bottom. And clean out and spray the door. Well, first you want to do the back and the front. Alright. Then with the clean towel or paper towel, you want to start wiping the kennel from the top like this. Then the sides. Make sure you get all the corners. The reason why we start with the top and then the sides and then last the bottom is because that way, usually the bottom is where most bacteria is, and dirt and nasty debris is on there. And so what you want to do the top first and the side is so that you clean anything that you're cleaning you clean the bottom, and then nothing from the top doesn't fall to the bottom. So nothing, no bacteria or dirt or anything from the top and the sides go down to where it's already clean. And then also you don't want to clean the dirtiest part and then clean the next, the semi-cleaner part. Alright. Okay. Then I usually make sure I use clean sides for each side that I clean. Like that. And then for the door, I like using another clean towel. I start from the back, going horizontally and vertically as well. If you see anything stuck in between, make sure you go in it and clean it. And then close it. as well. Continue cleaning. Alright. And take the dirty towels to the washer. That's how you properly disinfect and clean a kennel.
For now.
Okay, for this next part of the video, I'm gonna do an internal anal-gland expression on Russo. He's a big dog, so I have 2 helpers to help me restrain him. I got some paper towels, a wipey, some lube, gloves, and a skunk off. First you wanna do is put some lube on your finger. Rub it really good on your finger.
You got it.
Okay. And then you express. And then you express the other one. That's just like so. And you wipe him good. Okay. And this is the anal glands. What I do is you put one finger in and express it from the outside and from both inside and outside, and express out the anal glands on both sides. Because they have 2 right down on their anal gland hole. And then you want to do is spray him with the skunk off. That's it. Yep. For this next part of the video, we're gonna do administer a tropical medication. In this case, we're gonna do a Virtual Trio, which is a tick and flea preventive. What you want to start is at the neckline of the dog and making sure you part the hair and you press a little bit. You can also go around the neckline, like on the sides, and then through the other side, just like that, and then go down the spine. So parting the hair, pressing and applying. Like Pup Pups, it's okay. And then right here, like that, and parting this down here, like that, and all the way down his spine. And make sure you let the owners know not to bathe him at least within 3 days so that the product doesn't fall off. And then for cats, where you want to apply it is just in between the shoulder blades, because cats can turn around and lick themselves, and we don't want them to lick off the product. So that's how you administer a tropical medication on a dog.
What was that?
Okay, for this other next part of the video, what we're gonna do is an ear cleaning on Russo. So first, what you wanna do is put some drops of the flush in his ear. And then massage his ear canal.
Boy. Good boy. Feel good? Does that feel good, huh?
Have some cotton balls, cotton tips, and gauze for you to clean his ear with. I like using the gauze so it gets all the gunk out of there. And then you can use the Q-tips to clean out in the creases of the ear. Make sure you don't go too far in. You can hurt him. Okay. And then use a, he can shake.
Not supposed to do that, but I can make my head.
And then with a cotton ball, clean it right in there. And that's how you clean it here. And then you also want to repeat the process on the other side. Just for yourself. Squirt some in there, massage his canal. ear canal. Get some gauze.
Nobody. Russo, come here.
And use the Q-tips to clean in the creases. If they were here for an ear infection, what you want to do is collect the sample before you clean the ear. Okay, and that's how you probably do an ear cleaning on a dog. Now, for this part of the video, I'm going to show how to properly clean the cat's ears. What you want to do first is put some gloves on. If you don't like the cleanser to get on your hands, then prepare yourself with some Q-tips, gauze, and cotton balls, and your otocytic medication, which is this. And then with your helper, she can scrub her a little bit, and you can place a few drops in her ears. Massage her ear canal. And then with cotton ball, clean her ear. Then you can use a Q-tip to clean the creases inside the ear. She has pretty clean ears, so there's not much debris in there. Also, be careful not to go too deep. You can hurt them. And then use a piece of gauze. Clean the rest. You want to repeat that same process on the other side.
Okay, shake it out, There you go.
Few drops in the ear. Massage the ear canal. Make sure that product goes in. No. And then use cotton balls. You can also use it to clean any outer solution. Like whenever she checked her head, a few got out. It's okay. Then use the Q-tips again to clean between the little creases inside the ear. And a piece of gauze. And that's how you properly clean a cat's ears. For this next part of the video, I'm going to show how to properly do a nail trim on a dog. What you want to do, I already poured some in there, but you want to get some Quick Start. Prepare yourself in case he does have a quick hem. And then these are the clippers we use to clip a dog's toenail. And you want to press on his pad and expose the nail. I'm not sure if you can tell, but what you don't want to cut is right where the pink is, so you want to just cut where the white tip is at, just like that. If you can go a little shorter, you can. In case a dog has black toenails, what you want to do is go slowly and trim little by little until you see the quick. And once you see the quick, you want to stop. And if you do accidentally quick him, you want to bring in your Quick Stop and put some in the tip of the nails, just like that.
Okay, you don't like your nails?
For this next part of the video, I'm going to show how to properly do the nail trim on a cat. And for a cat, it's a little bit different from a dog, because you want to do is press on the pads and make the nail come out, and then use a smaller nail trimmer like this one and But you also don't want to trim where you see the pink, because if you do, that's so quick and they can bleed. And if they do end up bleeding, what you can do is put a little bit of quick stop on a piece of gauze, and then put a little bit on that nail tip to stop the bleeding. And that's how you properly do a nail trim on a cat. For this following next part of the video, where I'm gonna show how to administer an oral medication through the mouth. We're not really doing. We're just giving him a little piece of a pebble. What you want to do is open their mouth and pop it right in the back of their mouth. You can give them a neck massage so they swallow, stimulate them to swallow, and you can also blow in their nose. Alright, and then you also want to do is administer some water at the end so that he swallows. Just like that. And then you can check and see if he didn't hide it in there somewhere. And you can check also your surroundings. Make sure he didn't spill it out as well. And that's how you administer an oral medication to the dog. For this other part of the video, I'm gonna show how to properly do an oral medication on a cat. We're gonna use the pill popper since they have smaller mouths, and we're gonna use a little piece of a pebble and put it right in the tip. Make sure you pull out the over there and have a syringe full of water.
All right, baby, ready?
What I'm gonna do is make sure it pops right in the back of their mouth, and then massage their neck. And you can also blow on their nose. And you can also administer some of that water.
Oh, yummy.
To make sure they swallow. And then check it to see if they didn't still have it in their mouth. She doesn't. And also check your surroundings, make sure they didn't spill it out. And that's how you administer oral medication on a cat.
Okay.